Hello everyone! Have you or a loved one been diagnosed with breast cancer? If the answer is yes, then it is essential to know everything about breast cancer. You would probably fetch your laptop and start surfing the internet searching for answers to know everything about your disease. But as we know, Google is not medically certified to tell you specifics about your case and stage. After all, Google is not a doctor. We are here today to help you know everything about breast cancer. Our role today is to answer most of your questions regarding breast cancer. Today we have Dr. Kim, who is a leading doctor at Chung-Ang University Hospital in Seoul. I'm Umay. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Kim.
Hello.
Can you please introduce yourself to our viewers?
I am Min Kim at Chung-Ang University Hospital's Breast Oncology Department.
Okay, Dr. Kim, what is exactly breast cancer disease?
When cancer begins in the breast tissue, it is called breast cancer. It can begin from the breast tissue or its ducts.
What is the etiology behind breast cancer?
First of all, breast cancer occurs when cells in the breast grow and divide in an uncontrolled way, creating a mass of tissue called a tumor.
Does breast cancer have any symptoms?
Yes, 70% of patients come to see a doctor due to some detection of lumps. So self-checkups are the leading reasons why patients come for medical help. In Korea, people are covered for a breast exam every 2 years. In the process, many are discovered to have developing growths and imbalances between the two breasts. Some women see their breast tissue as thickened or feel they have skin that mimics peeled oranges. Also, the nipples may have discharges which are not milky colored, but reddish as it is mixed with blood.
Can you tell us more about the methods of diagnosis?
First, mammography is the worldwide standard and is included in the biannual exams in Korea. If we find abnormal changes after mammography or ultrasound, we do more focused exams to determine presence of cancer, such as mammatome, which collects tissue from small incisions for biopsy. Microcalcification cannot be easily detected through regular exams, so we use mammatome or other surgical detection methods. Once we know there is presence of cancer, we utilize MRI to take a close look. MRI has very good precision, so we can see what we could not see with just ultrasound or mammography.
So breast cancer, how many stages does it have?
We have from 0 to the 4th stage. At stage 0, it is non-invasive. But from stage 1 and up, the cancer can travel and affect other tissue, as it can travel through the veins and lymphatic system. The cancer severity changes depending on the size of the tumor and whether it is expanded through the lymph nodes. When the tumor size is smaller than 2 centimeters, it is classified as stage 1. Once the cancer has affected the lymph system, it is at least stage 2. While in the past we simply looked at the size of the tumor and whether it has encroached the lymph system, today we also look at the biological markers to determine the exact stage. We look at tumor grade and feminine hormones detected.
What are the types of breast cancer?
If started in the ducts, it is called invasive ductal carcinoma. If started in the breast tissue, it is lobular carcinoma. Ductal carcinomas are more common and represent about 70% of cases. Using Ki-67 marker, we can further subtype into 4 invasive carcinomas: luminal A-type, B-type, HER2 overexpression type, and triple negative, which are cells do not contain receptors for estrogen, progesterone, or HER2.
So what are the usual treatments for breast cancer?
When the breast cancer is localized in the breast and ducts, we can consider surgery. The surgery can vary in range from partial to full mastectomy surgery in cases where the tumor is large or has hardened. After the surgery, we try to preserve the shape as much as possible, and we work closely with plastic surgeons when needed. We can use implants to shape the breasts. We cannot say that surgery alone is fully efficacious. We would use treatments to limit the recurrence. Also, radiation and various chemotherapy treatments depending on subtypes.
At what age are women more susceptible to breast cancer?
If we separate Asia versus Europe or the West, the most common ages are different for breast cancer. In Asia, we see women in their 40s and 50s as the most common age groups. In the USA, it is most common with women in their 60s and 70s. It is generally known to occur more often as one ages. In Korea, if we compare women before menopause and after menopause, 20 years ago there were more cases of women before menopause. But today, those after menopause is more common, at about 60% of total cases. As one ages, the potential factor for cancer increases in various measures. Old age itself becomes a factor contributing to breast cancer. So as one gets older, exams should become more frequent.
So is there any predisposition to the disease of mammary glands?
First, there is genetic factor as a risk for breast cancer. The most well-known is the BRCA1 and 2 mutation. For example, Angelina Jolie found out through blood tests that she had the genes, so she had both of her breasts removed. So it became more known to the public. In addition to BRCA1 and 2, markers such as ATM, TP53, PTEN, and PALB2 also increase the potential of having breast cancer.
So what is the hereditary anomaly of genes BRCA1 and BRCA2?
Yes, those help in repairing cells' DNA damage. Possibly due to mutations resulting from external influences, cannot act normally and carry out its role. Thus, cells divide and multiply in an uncontrolled manner and result in cancer development. Those with BRCA anomalies are 80% likely to develop breast cancer by the age of 80. Whether this situation affects other organs is not yet known, and more research is needed. For men, those with BRCA mutations are more prone to pancreatic cancer and men's breast cancer.
So do you have to take special care after getting full treatment of breast cancer?
First, since breast cancer is closely related to hormones, it is assumed that after menopause, weight gain follows, which increases the likelihood of breast cancer. It is recommended one exercises regularly to maintain a healthy weight in order to prevent the likelihood of breast cancer. Lifestyle and habits are important. Alcohol consumption is also related to breast cancer, so it is important to cut down on drinking. Also, those with jobs that require to stay up at night and sleep in the daytime are also prone to breast cancer. So those with such nocturnal jobs should take more frequent exams to monitor their bodies.
So can a woman have healthy children after being diagnosed with breast cancer?
Yes, even after surgery, breastfeeding is even possible. One downside is that after chemotherapy, there can be loss of function to some degree of the ovarian system. So now we use medicine that stalls the function during the chemotherapy treatment in order to protect the ovaries. When done in such manner, menstruation returns within a year for about 90% of patients. But for about 10%, the ovarian function does not return to normal after the surgery. But when we look at our past patients, many return to normal and have normal pregnancies and births. In some cases, we advise to store eggs for later use, especially those who are of childbearing age and are eager to have a baby.
So how often does breast cancer recur?
Recurrence can be classified into 3 groups. There is recurrence that happens within the breast cancer area, distant metastasis, whereby the cancer spreads to other organs, and regional metastasis, whereby the cancer spreads to adjacent areas. When not aided by supplemental treatments, about 40% recur within 10 years. But when aided by radiation or various chemotherapies, the recurrence drops to about 20%. But looked another way, we cannot use the percentages in a blanket manner to everyone. Those who have treated early at stages 0 or 1 have very low recurrence rates. This is why we try to catch the problem early, so that there is low recurrence after treatment. So those who have caught the cancer early and treated it, when the stage was 0 or 1, the success is 90% when seen from a 5-year period post-surgery.
90% 정도는 5년 동안 이제 재발 없이 잘 지내실 수 있다고 이렇게 보고 있습니다. Last question. How can we prevent breast cancer?
Since cancer does not start from one particular disease, and there are a combination of reasons behind it, ultimately prevention is not that easy. So we must focus on what triggers breast cancers. Since it is closely related to hormones, those who start menopause too early or stop too late can have additional risks, as the female hormone does play a role. To limit the risk, it can be beneficial to have many births, or to have babies early can help. Having babies and breastfeeding cuts down on the risk. These can be preventive measures. After menopause, those with genetic risk factors should avoid taking female hormones, as it will elevate the risks.
Or what is the difference between benign and malignant breast disease?
Sure. First, the genetic factors are different. Benign tumors do not expand to other organs or tissue. If the size is too big, is in a location that hinders or gives pain, or continues to grow larger, then it is good to have it removed surgically. But if the size is small and insignificant, it is okay to leave it as is and simply have checkups once in a while. But in cases of malignant tumors, it can travel via the veins to other organs and tissue, and eventually rob the body of nutrients by the malignant cells. In such cases, we need a quick intervention and treatment.
Thank you so much, Dr. Kim.
Thank you.
Yes, today we learned about breast cancer. If you know and deal with the symptoms of breast cancer in advance, you will be able to treat them before developing a larger disease. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.